Good evening, everybody. Thank you so much for joining us. I'm Dr. Michelle Weitzel. I'm the Executive Medical Director in Cowichan with responsibility for overseeing the clinical aspects of the CDH Hospital Redevelopment Project. I'm excited to be here this evening so that our team can share with you all the tremendous work that is happening on the road to the new CDH. We'll get underway in just a moment, but before I introduce our first speaker, I wanted to let you know a couple things about the Zoom webinar. This session will be recorded so that those who are unable to join us live can watch it when it's at their convenience. You may see a consent button pop up when we begin recording. As this is a webinar, only the speakers will be visible and audible. After the presentation, there will be times for questions and answers, at which time you can choose to display your name along with your questions, and you can upvote questions that are of interest to you. With that, I'm pleased to introduce Cowichan Tribe's elder, Tu Salem. Earlier today, Ron hosted a workshop for our team to share the significance of the land blessing ceremony, which he conducted on the new site of the new hospital. We are so grateful that he's joining us again today to open tonight's meeting.
I am thankful to be here tonight. I guess I come from the place of just the echoing of our elders, and every time that they would always remind us. So I remember even my late mom, she was in her 90s and had 12 of us in the room, and she would always remind us in our language, the Halkaminam, would always say, Stu Kashinto, walk together. Always that reminder for you and I to walk together. And how that came to be to Chitsawato, Shieya. Says always be there to help. Be there for that one, your neighbor, whoever it may be, always be there to help out. So, just always seemed to be a part of our life. And so when I think about this new big house that's going to be in place, how we are all going to be that one coming together, that not so much swallowing, coming together with the one mind, one heart. And always leave at that door of this new big house. Chihwam to me nu ilam siyam siya. And so what they're saying, please come in, my highly respected friend. So just those moments that I can feel being with each one of you, and being with Joe on the land, just to be a whole total part of this inclusion of who we are in this home of the Cowichan Mastimo, the Cowichan Shieya. So I want to give thanks to each one of you. And so when I think of so many things for a song. And I always go back to my mom. I always go back to my grandmothers. I always go back to my great grandmothers. And especially in the home of the new big house, going to be on that sacred land, how our people refer to us as the Chat Kamov, the sacred ground that this big house is going to be on. So that's at every part that you and I are standing together and to make that happen. So I share this song that I think about Mother Earth also and how she is providing us this place for each one of us for this brand new big house that's going to be on this land. So I ask each one of you to come within your own mind, within your own heart, and to bring in whoever may comes into you. For me, it's my mother and my grandmothers that I think. They are the loving caretakers of so many of us. That home will stand so strong being our grandmother. So I share this song that it's the woman's honor song. So I just want to mention that when we go to a ceremony and there could be anywhere from 600 to 1,000 people in the longhouse. And so on, with all of the work that's happening, you can see silently around that whole room our elderly woman just raising their hands to each relation that are there, that are singing, that are dancing, that are prepared the table. I can see them doing that for each one of you, silently raising their hands and thanking you from the bottom of our heart and making that place, that home to take care of all of our relations, to look after them. I thank you. And so that's it for me. Haichka.
Haichka, Susilan, thank you. I'm proud to continue this session with a number of acknowledgements. I am grateful to be zooming in from the unceded and still occupied territories of the Simcotan and Lekwungen speaking people of the South Island. It is a privilege to live, work, and play in this amazing part of the world. Next, I would like to bring your attention to our Zoom backgrounds that includes an Every Child's Matter art piece, which Cowichan Tribe's artist and educator, Stuart Pagaduan, has kindly permitted us to use. I would also like to acknowledge that the new hospital will be built on the unceded traditional territory of the Cowichan Tribe's people. It is being built to serve the people that live in the region outlined on this slide, which encompasses the territory of the Coast Salish family nations of Cowichan Tribes, Penelakut, Halalt, Stuminus, Liaxin, and Malahat, and the territory of the Nuchalmouth family nations of Tsupasit, Dididat, and Pachidat. It will also serve people from the Métis Nations, Inuit Nations, the House of Friendship, Hayayulelim, and other First Nations people from across the island, province, country, and even continent. Island Health recognizes the harm caused by colonialism and the ongoing impact this has had on health and wellness of Indigenous people. Elders have shared with us how the experience of the residential schools and the Indian hospitals are intertwined and have eroded trust in healthcare institutions and prevented them from accessing care when they need it. With the recent confirmation of the remains of 215 children buried at the former Kamloops Residential School, 715 unmarked graves in Saskatchewan, and 182 unmarked graves reported today near a former residential school outside of Cranbrook, we, as health service providers, are committed to addressing what has been a long known in communities and has been reported on in numerous inquiries. Today, I was fortunate to have witnessed part of the land blessing ceremony at the new hospital site. For me, this blessing symbolizes a new start. It's a remarkable gift of the Cowichan people to bless the land where we will be building the new hospital. This gift gives Island Health an opportunity to do things differently, in partnership with local First Nations, so that the hospital is a place for all people to receive safe care. By continuing to build these critical relationships with our First Nation partners over the course of this project, my hope as a clinician and a leader is that we create a place of healing that can be trusted to provide care that is free from inequity and discrimination and will be a step towards reconciliation. Tonight, we will share how we are actioning our commitment to eliminating Indigenous specific racism and creating a hospital where people feel safe and welcome. The next slide is the introduction slide of what we're going to talk about tonight. You'll see we're going to talk about the project update, the core services and new features in the new hospital, our engagement to date and future opportunities. The CDH Foundation is going to speak, and the Community Benefits Agreement Program Leadership is going to speak, followed by some questions and answers. To get us started, I'd like everybody to introduce themselves on the speaker panel. I will say their name and then they will introduce themselves. Firstly, my co-lead, Alice.
Good evening, everyone. Alice Goutke, Executive Director for the Cowichan Valley.
Wesley.
Good evening, everyone. I'm Wesley Davidson. I'm the Chief Project Officer for the Replacement Hospital. Nice to meet you.
Carrie.
Good evening, everyone. I'm Carrie Beauchamp. I'm your Director of Design and Construction.
Deanna.
Hi, everyone. I'm Deanna Ford. I'm the Director of Sustainability for Island Health.
Joe?
Yes, it's Quill, Joe Elliott, Indigenous Engagement for the project. Thanks.
Dr. Pat Gallagher?
Good evening, everyone. I'm Pat Gallagher. I'm the Medical Director of the CDH Replacement Project.
Janine?
Hi, everyone. I'm Janine Kidd. I'm the Clinical Project Director for the project and co-lead with Pat Gallagher.
Tracy?
Hi, everyone. I'm Tracy Brown. I'm the Interim Executive Director of the Cowichan District Hospital Foundation.
And Greg?
Good evening, everyone. I'm Greg. I'm with a group called BC Infrastructure Benefits, and when construction is underway on this project, we are the provincial crown corporation that's going to be employing all the skilled trades workers when building the new hospital.
Great. Thanks, everyone. The next slide shows the vision and principles of the project here in Cowichan and what we all aspire to. I'm going to start with the next slide, which is Alice, and she's going to talk about the Cowichan Health Care Plan.
Thanks, Michelle. The Cowichan Health Plan, parallel to the development of the business plan for our new hospital, a comprehensive plan was developed for the Cowichan Valley. This plan will enable us to create a culturally safe, fully integrated, comprehensive, and accountable system of care in Cowichan. As this slide reflects, our new hospital will be a key component of this vision, but equally important will be how our health services, in the broadest sense, work together to ensure patient-client needs are met while in community. Providing the right type of care in the right place and at the right time, which we know results in both an improvement in the quality of care as well as improved patient and family experience. So as stated, in preparation for the new hospital, the Cowichan Valley Health and Care Plan will identify strategies to reduce the use of our hospital beds and support our patients better by developing and enhancing community-based services and closing current gaps in care. Next slide, please. The plan will run concurrently with the CDH build over the next 4 to 5 years, ensuring that upon opening in 2026, the beds in the new hospital will fully meet our community demand. The second phase of the plan will focus on the ongoing and increasing demand for health services due to continued population growth, ensuring sufficient capacity in CDH until 2035 and beyond. Specifically, we are looking at helping people avoid hospital stays at the rate of minimally 20 hospital beds annually by 2025 and 32 by 2035. The options we are recommending come from evidence-based literature reviews, the use of population health and CDH utilization data, as well as input from expert panels that included both local and regional clinicians. Our findings brought us to 4 main areas of focus: chronic disease, specifically COPD and pulmonary rehab, people who are experiencing frailty or reduced function in health and are therefore more susceptible to illness, palliative care, and mental health. These areas were identified as having a high probability of supporting patients to avoid hospital care if appropriate community supports were in place for them. A draft roadmap was proposed outlining the required resources in each of these categories that could increase our hospital capacity and in the medium or longer term, improve health and wellness for people in our community. For example, developing a COPD clinic and outreach service that would have an immediate impact, introducing secondary prevention, such as smoking cessation, that would offer short-term to medium impact, and then primary prevention measures, such as focused education for adolescents on the harmful effects of smoking. This would improve the health of our community in the long term. Since the completion of the final report in March of 2020, 3 of the proposed initiatives have already been implemented, including the opening of the Hamlet's long-term care beds in April 2021, 8 Island Health funded hospital beds, which opened in the fall of 2020 and have reached full census as of April 2021, and our STEPS unit, which accommodate patients who no longer need acute care, but need more than can be offered in their homes. Hospice and STEPS are already exceeding the plan's projected bed days saved. In addition, as well, a very positive care experience for patients and families. As we roll this multi-year plan out, we will focus on the strategies that have the biggest impact first, building on existing services, including the already strong foundation in areas such as our primary care network, which will continue to strengthen integration between primary, community, and acute care. I'd like to hand off now to Wesley Davidson.
Great, thank you, Alice. Good evening, everybody. I'd like to orient you firstly to where the new hospital is located. This is an extract from the local area plan. The Trans-Canadian Highway is the northern, or the top of the page, running left to right. And that, sorry, my slides are moving on me. It's located, the new hospital is located on Balmakinnon Road, just off Herd Road and the Trans-Canada Highway. The orange section, which as I said, it was an extract from the approved local area plan, is a mix of employment lands and lower density residential transition into medium and high density residential approaching Herd Road. The central is a mix of mixed use area framed by high density residential with employment lands remaining adjacent to the highway and a new hospital integrated within the core neighbourhood village. Next slide, please, Audrey. The new hospital is approximately 46,000 square metres, which is 3 times larger than the existing Cowichan District Hospital. It will have a capacity of 204 beds, up from the 134. We actually just this week added 3 additional beds to bring us to 204. You may have seen some previous documentation with 201 beds. Because of the need, we have added 3 additional mental health beds. We will be operationalising 184 of those beds on day 1, and 80% of the rooms will be private. In terms of the funding for this project, we have approved funding of $887.4 million. The CVRHD are providing funding to the tune of $282.6 million. We also have contributions from the foundation. Next slide, please, Audrey. Thank you. So Balmakinnon Road is shown here on the left. And as you can see, we have a large number of parking stalls. There are 800 to be accurate. And that parking is free. I know there's been some discussion in the community about whether the stalls are free or not. I can assure you that those stalls are free. We are connecting to municipal services. We are undertaking stormwater management on the site to mitigate any additional runoff. We're providing a therapeutic garden. Just to orient you in terms of the services that are being provided, this is an indicative design, so it will not be, it's not the final design. We're working with 2 proponents as we currently speak to develop the design further. But to orient you, the northern box that you can see that says D/T includes the combined emergency. We have medical imaging, ambulatory treatment on the ground floor. We have the second floor including ORs, ICU and HAU, and then the 3rd floor provides support services. The southern block there, which looks a little bit like an X, is a 6-story tower which provides maternity and inpatient units. And we are currently in the process of working with the municipality of North Cowichan to ensure that we are meeting all of the requirements. Next slide, please. So this image is a pictorial image of our draft concept plan, and it is subject to change. We are in discussions with 2 proponents through our procurement process, and we will develop that further with them prior to coming back to you to outline what the final design looks like, likely in Q2 of 2022. The Indigenous illustration that are shown there, I would like to thank Chaz Elliott for providing that. It is an illustration representing courage, but we will be working through our Indigenous Advisor Committee to determine the artwork. So this is just a representation at this time. Next slide, please, Audrey. So key features of the hospital. So we have existing and newly added services, as Alice mentioned, in the health and care plan. And we'll be delivering those with strengthened linkages to community-based services. We are also trying to get the right mix for parking, public and active transportation options. This has been an ongoing discussion within the project team and will continue to be developed with the proponents. And I can reiterate that we are providing free parking stalls, 800, which is up from the 400 that are currently provided on site, on the existing site. The new site will also be accessible by wheelchair, bus, public transit, bicycles, helicopters, ambulance and cars. We'll also have the opportunity for pedestrian traffic in the local area. Helicopter flights, I know there's been some questions around the number of flights, so there are approximately 50 a year. That is on average what we have seen out of the existing space, so we're not anticipating any additional. It will also be used as a training facility for clinical staff and students. This will include the UBC medical students and residents, nurses, allied health, NDRD technicians, unit clerks, and many others. Next slide, please, Audrey. So the project is going to be designed to a post-disaster standard. So what does that actually mean? It means it's designed to provide a safe haven after a disaster, including redundancy and support systems. So after an earthquake or a major event, the hospital will be fully operational to provide service as needed. We've also learned from the last 18 months through pandemic learnings, and we are in the process of evolving and monitoring and incorporating learnings from the pandemic into the new build. We need to provide flexibility and we need to provide safe care during similar events. This includes improved isolation capabilities for clinical areas, thoughtful consideration of patient flow and staff throughout the hospital. Next slide, please, Audrey. Thank you. So where are we in the overall project timeline? So currently, we're in the procurement stage. We are looking to complete that in Q1 of 2022. We would like to start work probably in the summer of 2022 with the target of opening to patients in late 2026. Next slide, please, Audrey. So in terms of our procurement process, we have two proponents. We have just evaluated their first RFP response. We're about to engage them for what's called the Alliance Development phase, where they start taking our indicative design and developing that further to come up with a proposed solution for the new hospital. We will expect by the end of this year that we will receive 2 compliant bids from those proponents, and then we'll start the evaluation for the announcement likely to happen in spring 2022, and then work starting from there. Next, actually, I would like to pass over to Deanna Fort, our Sustainability Director. Thank you.
Thanks, Wesley. Yeah, so when considering the environment for the new CDH, the project team identified the 7 priorities noted on this slide. Island Health is very committed to environmental values and sees the environment as part of the healthcare system. A major consideration throughout the project has been and will be minimizing climate impacts, and at the same time, making sure the hospital and grounds will be adapted to changing climate. The team recognized the local concerns regarding air quality and the opportunity that minimal to zero use of natural gas for heating will result in minimal combustion from the new hospital. Air quality monitoring on site will also be used to maintain optimal indoor air quality. Domestic water consumption is essential for hospitals, but also must be conserved and used as efficiently as possible, and therefore is a priority. Island Health recognizes the amount of waste created during construction, so we'll be asking proponents to come up with strategies to achieve the maximum waste reduction. In construction, they will also be minimizing the use of toxic chemicals that impact workers, as well as kind of off gas in the new building. Paying attention to the indoor environment provides space that is comfortable for the occupants, gives access to daylight and views, and includes things like opening windows. Although there will be lots of development required to build a new hospital, the project looks for opportunities to conserve and restore the existing habitat and incorporate those elements into the design. We can go to the next slide, Audrey. We'll be using LEED Gold certification to ensure that the environmental priorities that we have identified are tracked throughout the project and verified at completion to achieve certification. The latest LEED standard has increased requirements to achieve a rating. That, along with additional efforts being made to lower greenhouse gas emissions, means the new CDH will have the most environmentally sustainable construction and operations of any hospital on Vancouver Island. The minimum greenhouse gas reduction that is being targeted is 80% below the 2010 level. This will result in the hospital being 97% electrified, which means that it's 97% operated on electricity. The proponents will be looking to see if they can take it to 100% electrified and achieve the net zero carbon building standards. Currently, this project is the only one in Canada registered for this program. There will also be a large solar voltaic array as part of this project to produce electricity on site. LEED buildings are very water efficient, and this will be a focus for this project as well. We are expecting a minimum. The hospital will be 60% more water efficient than the existing hospital. As we've experienced in the last few days, extreme climate event, climate change is occurring. And that means we can expect the warmer temperatures for longer. Unfortunately, more forest fires, strong windstorms, drought, and intense rain events. In recognition of this, the new hospital will be adapted for the changed climate on opening day, and it will be resilient to the changing climate over the lifespan. The site has, as Wesley has mentioned, some natural assets that the team wanted to conserve and work with. This includes the wetlands that will be consolidated into a single large pond in the southwest corner of the property. The wetland and bioswale along the south of the property will provide natural management of stormwaters on site. These features will be enhanced with locally adapted plantings and provide pleasant views, a place to walk and sit near the water. There is a large stand of Douglas fir trees on the property that will be conserved and become part of the wellness walk. Getting to and from around the site will be considerate of a green and active transportation options. Bicycle and pedestrian circulation will be facilitated through planning and design and will be separated from vehicular traffic through the use of bike lanes. Sidewalks and physical separations. There'll be charging infrastructure for cars, roughly around 6% of the total parking, and for bicycles as well. This is just the highlights of the environmental considerations that will be part of the new hospital project. And yeah, I'd like to introduce Joe Elliott.
Yeah, throughout the process, there's Indigenous engagement with the First Nations community has been facilitated. They met with the majority of all the First Nations within the area for the Cowichan District Hospital, and looking at some reconciliation strategies. And so one of the positions in reconciliation is a position of Indigenous Engagement Manager, which was carried by Mary Knox for a few years, and then I have taken on that role. There's an Indigenous Advisory Council that was created and supported the development of the concept plan and business plan. And currently, we're working on an Indigenous framework, looking at building some of the best practice and best ways and building partnerships and relationships with our First Nation communities and Métis Nations and Inuit. And cultural safety is going to be a competency, and competency training is going to be done throughout the whole process with our project team and various other people that will be working with the project. The architect design, and we'll have Indigenous base, as you saw in the plan there. Hopefully we'll have Indigenous work throughout the process, new hospital. And landscape, recognizing the importance of our native plants and the surrounding area. There'll be a traditional gathering space, wayfinding language that would be incorporated within the whole process. And you know, I see the importance of the traditional gathering space. A few years ago, my grandmother was placed in an elders facility because she couldn't look after herself. And you know, during the time I visited her on a daily basis and then sang Hulkaminum songs to her and spoke the little Hulkaminum that I knew. And after that, we brought her to a traditional ceremony, a mass ceremony, where we passed on some mass to my younger children. And so we were able to get her out for the day to witness that. And the next day I went to visit her, and she wasn't able to speak she wasn't able to speak, but the day after, she was able to speak enough to say, "Son, you helped me," but you know, it was broken, but I was able to understand that. So, you know, the traditional gathering spaces, you know, the importance of that is bringing our knowledge and our traditional and an opportunity for our families to come together when they're in the new hospital. Next slide, please. So there'll be offices and support for the Indigenous department and programs. There'll be a multi-purpose room and a teaching kitchen, a short-term stay suite for individuals that are traveling, especially our community members that are traveling from that picture that in the winter times when maybe the roads or the snow, or there's maybe the bridge is washed out or part of the roads washed out, and they're visiting their relatives at the hospital. So there'll be that opportunity for family members that are attending the new hospital. And already covered the gathering space. Next slide, please. And so if you get some of the concepts that was built from the COMOX and some of the learnings in regards to some of the designs, and some of those learnings will be brought into our process as we move forward. And our project team have already had an opportunity to participate in many workshops in regards to some of the local First Nations elders coming and give us some teachings and recognition in regards to the concepts of traditional buildings and the meaning of that. We've also brought an elder in to do some spiritual preparation of the land, creating and clearing a pathway as we're moving towards building the new building. And I think our elder talked about the Thi Lelam, a place of coming together for healing, a place of working together. And so those are some of the opportunities that our project team has participated in, hopefully continue moving forward and working in partnership in a good way. Thank you.
Hi, everybody. This busy slide has all the services that are going to be provided in the new building. I've spent most of my life in the Cowichan Valley, and I remember the opening of the current CDH as the new hospital as a youth in the valley, and the pride the community had in that new hospital at that time. At this time, I think we'll be able to take great pride in what we're developing in the new CDH. There'll be, as Wesley mentioned, 204 beds total. 148 of those will be medical surgical beds, currently planned as 4 floors of 37 bed wards. There'll be a critical care area, which will be close to the emergency department, which will have 6 ICU beds and 8 high acuity unit beds. Psychiatry, mental health and substance use is now a 20-bed unit. There will also be, in addition to that, a 4-bed psychiatric intensive care unit. Perinatal, labor and delivery will be 10 beds. 8 of those will be labor delivery rooms. These are rooms that are designed to accommodate the entire stay of the mother and through her labor, and then the mother and her babe following labor and delivery. There will be one operating room attached to the maternity, right in the maternity unit, and a newborn nursery. This special care nursery will be a really useful feature in allowing more mothers to remain at Cowichan for their deliveries and their postpartum care. Attached to the maternity unit will be the Cowichan Maternity Clinic, and there'll also be an ambulatory care, an outpatient clinic for perinatal. There'll be an 8-bed pediatric unit. 4 of those will be general pediatric beds, and 4 will be focused more on mental health. There'll be outpatient clinics associated with the pediatric unit, and this will allow for surgical, preoperative, and postoperative care to be provided from the pediatric unit for the operating room. The emergency department will be 3 times larger than the current department. There'll be 2 large trauma rooms, acute and fast track area. There'll be a rapid assessment and discharge unit. There'll be a zone that will be focused on psychiatric care that will have its own dedicated entrance and also an outdoor courtyard. Put the size of that in perspective, we currently at CDH have 5 beds that are capable of providing monitor care. There will be 24 such beds in the new CDH. Medical imaging will have 1 fixed MRI. There will be 2 CTs, one of which will have its footprint actually in the emergency department as immediately adjacent to medical imaging. There will be general X-ray facilities, and again, 1 X-ray unit will have its footprint within the emergency room as well. There'll be fluoroscopy units for interventional care, mammography, ultrasound, and bone density. New to CDH will be a large ambulatory care unit. So we'll have 3 pods of clinics that will be available for things like diabetic daycare, for visiting specialists. There'll be an orthopedic clinic, which will be a 4th such pod. There'll be a community cancer clinic, which will have 10 beds available to it. That should be 10 treatment rooms and an associated chemotherapy pharmacy attached to it. There will be a 10-bed medical daycare, which will also be an infusion clinic. There will be outpatient rehab and occupational therapy services in a large area on its own. There'll be a diagnostic outpatient services for cardiac diagnostics, which has space planned for a pacemaker clinic as well, and pulmonary testing. There'll be a pre-surgery clinic and an anesthetic clinic. The operating rooms will be much larger in size individually as operating rooms and in number. There'll be 6 operating rooms, and there will be 9 procedure rooms. These procedure rooms are about the size of our current operating rooms and will accommodate procedures requiring no anesthesia or procedural sedation. And there'll be a large pre and post anesthetic care unit. And there will be, in addition to that, all of the support services that are listed on the right side of this placemat. Thank you. I'll pass on to my co-lead with the clinical portion to Janine Kidd.
Hi, thanks, Pat. So we wanted to talk a bit about the engagement that got us to the place that we are now. And so in the various stages of work that we've done, we've worked anywhere from 30 to 41 different user group sessions since 2018 in the business plan that led to the approved business plan. And then since then, working towards documentation that will support our bidders in defining and designing a future hospital for us. We also have had amazing physician engagement during this time. We have a physician lead for each of our key clinical areas, and they link back with larger physician groups and seek guidance from them and feed that back into our working groups. We've also had support from the Medical Staff Association at CDH, as well as the Division of Family Practice, and have been able to engage with general practitioners in the community as well. We've also had many and several special topics and working groups that are technical or both technical and clinical in nature, so that we can attend to all of the various support needs of this future hospital and define them. Things like infection prevention and control, site work, sustainability that Deanna spoke to earlier, just to name a few. We also have FMO and housekeeping, food services, and anything that supports the function of a hospital. So there's been significant intense user groups sessions, anywhere from an hour with a smaller group to 6 hours with a complex and larger group, and then rechecking our understanding as we go along. Next slide, please, Audrey. We wanted to talk a little bit about some of the public engagement that we had early on in the project, in particular around the time of the business plan, and highlight some of the things that we heard and have since then incorporated into this future hospital. One of the comments related to engagement of frontline staff in the design process. We have had frontline staff to date involved in our user groups. And additionally, we're fortunate to have Lindsay McEwen, a professor at BIU, asked to work with us on some environmental psychology research, which will allow us to benefit from the input of all staff who submitted in that research. And then we'll be able to retest once we open the doors to see what impact the design and what architectural features and design elements were considered supportive to frontline well-being and work environment. So that's a very exciting opportunity. We also will continue to have that frontline engagement and in a number of different forms as we go forward. Another area that came up through our public engagement was including gathering spaces and spiritual health spaces, and I think Joe spoke to that in his section. We also heard about this notion of a resource room. So the resource room is intended as an interface space between the hospital and the community, a place where resources in the community can be highlighted or identified, and possibly community resources might be able to put a notice up to say that they're available and present to talk to people on a given day or at a given time. So it's intended to be an information resource space and a community services linkage space. So that came from our community engagement as well. Pat referenced a number of the pediatric services and child-centered care aspects. So putting all of that together, there's the inpatient unit with the mental health supports, the maternity child area with the nursery supports. There's the outpatient services and clinics that are possible in this future, as well as the pre and post-surgical. Additionally, in the emergency department, we will have spaces that are primarily for pediatric function, as well as some identified space for pediatric mental health and stabilization. So all of those aspects are part of the pediatric offerings in that future hospital. We also heard about improved electronic health records and enhanced telehealth and virtual care options. Some of the work that we're doing is to really see what we can bring into the current site now. Our goal is to minimize the cognitive burden or the burden of learning when you move into a new facility. So where we can bring some of this new technology into the current CDH, we'll be doing that so that when people transition over, they're more comfortable using that in the new environment. Our new hospital will be very technology enabled, so enhanced telehealth and virtual care is a prime part of that. Of course, technology changes very quickly right now, so exactly how that looks in that future site will evolve much closer to opening day. We will have specialized rooms, but we'll also have mobile technology that we can then take to people's rooms or into other clinic areas. Next slide. What happens next? So we're, as defined, we're in a procurement period. So we're looking for our bidders to come forward with designs. As we work through that project process, we'll be continuing to do engagement with our user groups. And as we move forward through the project, there will be a number and many other touch points with our user groups. So through detailed design, workforce planning, staffing model design, and the new, once we have a final design for that building, we'll have to figure out what the best staffing model for each of the different areas is. And then we'll also be working with our groups around how to transition to that new site, doing education and making sure that everyone is ready to begin on opening day. We're looking for consistency across phases as much as possible. We want to bring the learning from day one all the way through to opening day. Where we can't get consistency, we've got orientation processes to support that. We'll be strategizing additional voices that we need to bring to the table and different ways that we can do that, particularly our community Indigenous voices, determining which key user groups we need that support for, and different ways that we can gather larger feedback. There will be new working groups. So working groups like wayfinding, landscape, art and culture, and interior design. Those groups haven't been established yet, but they will be a key part of our detailed design going forward. And we'll be looking to our Indigenous Advisory Committee to provide us some guidance as well on how best to establish some of these working groups. And additionally, as mentioned, we'll be strategizing around ongoing staff and public engagement. Our proponent, our successful proponent, will also play a part in that piece of our work. So as we strategize now, we will be reconnecting with our proponents and benefiting from their experience in technology as well. And I'll pass over now to Tracy Brown, our Executive Director for the CDH Foundation.
Hi, I'm very grateful to be speaking to you from my office on the traditional territory of the Cowichan tribes. On behalf of our staff and our board of directors, led by our chair, Jerry Doman, let me say how happy we are to be joining you tonight. Sorry, I lost my place. Just 1 second, please. For over 37 years, the Cowichan District Hospital Foundation has been raising and stewarding funds to support the equipment and patient care needs at CDH. And we're very proud to be supporting the excellent healthcare teams we have here. In this time, the foundation has raised over $21 million. Some of our recent projects are highlighted here. We're very proud of our work for the new hospice house. We gave $1 million and then put up another $500,000 to be matched by the community, and you responded generously and in record time. We're also very pleased that we could add 8 new beds to the current hospital. We're proudly connecting the community to the needs of the hospital, whether it's running a campaign in support of a new piece of equipment or stewarding a bequest from a community member. We're here to serve. Next slide, please, sorry. In 2015, the foundation created the new hospital fund with an initial investment of $1 million, which we've since grown to nearly $4 million. We're committed to making the new hospital a reality in our community. A modern, innovative new hospital, along with the health and community care plan, will dramatically improve healthcare in this community, in the Cowichan Valley. I truly believe this will be the best community hospital in BC when the doors open, and we're all very excited to be a part of this. Next slide, please. There are many ways to give to the hospital foundation. One of our recent programs, the 50-50 program, we just drew the latest winner today in our June lottery, and they won over $8,000. You can also give a donation. There's a number of ways to do that, either online on our website, or you could mail or drop off a check, or simply call us to discuss your options and give a gift with a credit card. Another great way to give is through community-led events. Are you hosting a party this summer? What about asking for donations in lieu of gifts? Are you a cycling enthusiast? What about a ride to benefit the hospital? We're looking forward to our golf tournament this September, the Storm and Norm Jackson CDH Foundation Charity Pro-Am. And we're also, of course, really looking forward to holding our gala again. Next slide, please. We want to hear from you. We're really looking forward to working with you in support of our new hospital. Equally, we've got to keep the existing site going. We've got an equipment list that with needs for the current site that will help patients now, as well as all of the exciting plans for the future. We really want to hear from you. We're already working with families who are raising funds to honor loved ones in the new hospital. And I'm looking forward to meeting more of you now that we're able to meet in person again and gather in small groups. So please be in touch. Thank you very much. And now I'd like to turn it over to Greg Johnson from BC Infrastructure Benefits.
Thank you, Tracy. Good evening, everyone. My name is Greg Johnson, and I'm going to take just a few quick minutes here to talk to you about who BCIB is and what we mean to this project. First and foremost, we are a Crown corporation that's owned by the province, and we exist because the province has decided to make the commitment that this project, this hospital project, is going to be delivered under what's called the Community Benefits Agreement. Now, the Community Benefits Agreement was announced by the Premier in summer 2018. And it's a way to make sure that when the province is investing in infrastructure, bridges, roads, Broadway subway, the Patillo Bridge, and this project, that the people closest to the project aren't getting just new infrastructure, but we're getting the most value that we can out of that investment with new jobs, and making sure that local businesses can participate in the project, and making sure that we're helping make sure that there's skilled trades workers and opportunities for workers to grow their careers close to where they live. The Community Benefits Agreement exists because there is a skilled trade shortage in this province. We're in the middle of it, and it's likely to get worse as more people in the province are set to retire and not enough people are going into the construction trades. So to try and fill the gap, the province has created a Crown corporation to make sure that we're actually encouraging those people and employing people on these job sites. Next slide, please, Audrey. So a couple things that's unique about us is that on this project, whenever the winning bidder, the winning company is selected for this, we're going to work closely with that company, and we're going to provide the construction workforce to that winning company. And so what we're going to do before then is we're going to spend a lot of time working with the community and with different communities up and down the island to get to get you familiar with us as British Columbia Infrastructure Benefits, and to get people to apply for work with us. We want people to apply in advance so they know, so we know who's available to work. And when the contractor starts building the project, they're going to ask us for those workers, and we'll be able to provide. So a few things that are important to note here is that we use something called priority hiring, and that's really a core of the community benefits agreement. And so that means Indigenous people, women and locals, and other people who are traditionally underrepresented in the construction trades, they get hired first on these projects. And for people that don't necessarily have the construction skills to go to work on a project like this, well, they can still apply to us. And what we can do is we can act as a connector, and we're going to help connect people to the upskilling or the training that they need so that they may not be ready for this project, but for the next time that there is a construction project or a highway project or something that's close to their community, then they might have those skills to be able to do that. I'm going to just treat this as an opportunity to introduce myself, and I was going to introduce my colleague Michelle Guerin today. Michelle Guerin is from Musqueam, but following the news about out of the Tinaha Nation near Cranbrook, she's decided to take leave, and after hearing news there, and so she won't be able to be here tonight. But certainly this is our contact information, and we want to be reaching out to really as many people we can in the coming weeks and months as we ramp up to construction to let you know about how people can get to work on these projects, how the community benefits agreements works, and how we can help you build more than just a hospital, but help build an actual human legacy to make sure that the investment that goes into such a project lasts for generations and generations. So that's my quick introduction to British Columbia Infrastructure Benefits and the Community Benefits Agreement. And now I'm going to turn it back over to Wesley Davidson.
Great, thank you. Greg, that was excellent, thanks. So as you may or may not know, since March, we've started to resume our regular communication and engagement activities. These include land acknowledgements. We had an announcement to the Minister. We've put out quarterly updates. We've started providing some behind the scenes videos and social media posts. We have these virtual information sessions. So we've had one staff forum and now this community session. And we're going to have more focused engagement sessions coming forward with the next probably community session in September, October. We also have a forward-facing community website, which is islandhealth.ca/new CDH, and that you'll be able to find a raft of information, including updated frequently asked questions, and we'll likely take the questions that we have today and add to those frequently asked questions. We also, if you wanted to contact us, we also have an email address, newcdh@viha.ca. That is checked on a daily basis during the week. So if you do want to reach out to us, then please feel free to use that website. Next slide, please, Audrey. Thank you. So that concludes our presentation. I would like to thank you all for attending. I would like to thank the panelists, our community partners, Indigenous advisors, and remaining community groups. So thank you very much for your attendance. We have a question and answer session now. And feel free, if you are familiar with Zoom, there is a Q&A button towards the bottom. We are happy to take questions. We opened Slido a week or so ago, and we have a few Slido questions. We're going to answer those first, and then we will answer the questions. I know there's been several that have been asked already. You can also upvote your questions if you feel there's a question that is of great interest to you. You can promote it so that it gets asked. And if we don't get to all of your questions, we have about half an hour, maybe 25 minutes. If we don't get to all of your questions, we will capture them and we will put those into the frequently asked questions document. So with that being said, maybe I can ask Vienna to ask the questions, and the subject matter experts that we have online, if you can turn your videos on and mics on if I need to lean on you. Thank you.
So we're going to start with the questions from Slido. So the first question is, have helicopter flight paths been determined?
Maybe I can start with that and I'll hand to Kerry after that. So yes, the flight path has been determined. We have a consultant on board and we are working our way through that. But Kerry, maybe you can add to more specific detail around the helicopter flight path.
Thank you, Wesley. I do have a graphic that will help us understand it a little bit more, if that's okay for me to share that.
Thank you, Kerry.
Thank you. So we're flying over the hospital at about 5,000 feet here, if you can imagine that. And the hospital is located right here in the middle of this bigger arrow. Bell McKinnon Road here, Heard, and then of course, Trans-Canada Highway there. So one thing to know about heliports is a little bit of understanding of how helicopters fly. They like to land and take off with their flying into the wind. And that's really an important aspect to remember. They, when they're approaching a hospital, they can really approach a hospital from 360 degrees from any point necessary. Vancouver, Victoria, up the highway, through the West Coast. So they can approach it any direction. And when they get closer to the hospital, this looks like to me about a kilometer or so out, you can see these two arrows that are wider spread. So what they do is if they're coming into a direction, they will come get themselves lined up to the hospital heliport, which is on the roof. And then they will slowly start to descend to the hospital over quite a long distance, landing on the heliport. Now, depending on wind conditions, they will either be taking off with their into the wind or landing into the wind. So what we do for heliports is we provide two opposing flight paths for them, and they're based on the prevailing winds in the Cowichan Valley. So depending on the year, they will be, taking off in one direction and landing in another, or in the winter season, for example, it'll be quite opposite. With that, the only other thing to really keep in mind is that it really is the helicopter operator that chooses the best of conditions for safety. That's the first rule for heliport operations. And then the last thing to remember is that when they come in at these angles, they're really quite high in the air. So you have to envision sort of a cone coming off the hospital that glides them to their flight altitude, which depending on weather can be quite high. So generally speaking, you will be able to see and hear helicopters, but they're really quite at a high distance until they get closer to the hospital. And with that, I'll stop and pass over the presentation back to you, Audrey.
Thanks, Gary. Deanna, would you like to ask the next question, please?
The next question is, how are the needs of children being included, not just pediatric? Because the current hospitals is geared towards adults with kids seen as mini adults.
Oh, great question. So Janine, I'm going to lean on you if I can to respond to that.
Thanks, Wesley. So I think I addressed some of this in my earlier comments, but there are a number of different areas where we will have pediatric specific components. So the pre and post surgery that Pat mentioned earlier will allow us to bring kids to the pediatric unit prior to their surgery, be looked after by pediatric nurses. And then once they're through their critical care stage of recovery, they will then return to the pediatric room unit post-surgery and then have that final care there before they get discharged home. So that's the pre and post surgery. We have outpatient clinic options on the floor, and we have some expansion spaces in our ambulatory care area as well that will allow us to consider specialist or other types of inpatient or outpatient clinics that will take place again on the pediatric unit, so that those staff who are trained in pediatric care are the ones providing that care. And then additionally in the emergency department, we will have a room that is a pediatric treatment room that is specifically pediatric focused. It will still be able to do other types of care because our emergency process requires that we always provide all of our rooms for whatever is needed in that moment, but that space will be there along with the child youth mental health spaces. So those are some of the ways. We'll also have landscaping features that support kids when they're there with others and not necessarily receiving care.
Thank you, Janine. Vienna, perhaps the next.
The next question is, how are patients' voices being included meaningfully? How are you ensuring diversity of voices is heard?
Maybe can I lean on Pat, Dr. Pat Gallagher to answer?
Thank you, Wesley. So we have put a lot of time and effort into ensuring that Indigenous voices are heard and have gone out to each individual First Nation that the Cowichan District Hospital will serve and met with them. We have met with the people from the Friendship House and from the Métis Nation as well. We continue to meet with all of those nations and update them with what is happening with the hospital and seek their feedback. Joe Elliott has worked very hard with the Indigenous Advisory Council, which also represents all of those nations. For other patient partners, we do include patient partners in our user groups. We do have patient partners in our clinical advisory committee. We do seek input to our website, and Audrey Larson, our communications director, actively monitors those questions and refers them to the appropriate people for investigation and answering.
Thank you, Pat.
The next question is the hospital project team concerned that some North Cowichan councillors have indicated their intentions to reject the Bell McKinnon local area plan so that no development can occur around the new CDH for the next 20 years?
That's an interesting question, and I think the probably the most appropriate answer is that we are aware that the municipality of North Cowichan is in the process of an official community plan review that includes the area that encapsulates the Bell McKinnon area and the new hospital. We are having discussions with the municipality, but I would recommend in terms of the overall area, Bell McKinnon area plan, that you reach out to the municipality directly. We are unable to provide any sort of guidance or feedback on that from the project team. So thank you.
The next question is, will natural gas be used?
We are going to try and reduce the use of natural gas. As Deanna had mentioned, we're relying heavily on electricity, but maybe I can ask either Deanna or Kerry to expand on that.
So I can take the question. Thank you, Wesley. And if I miss anything salient, Deanna, please feel free to jump in there. So we are highly electrified. As Deanna pointed out in her presentation, we're close to 97% electrified now. And we are, as also noted, seeking full electrification. We don't know at this time if full electrification means no natural gas. We are a post-disaster facility, so we may have a natural gas option for redundancy, but our very high preference right now is to be fully electrified. Thank you, Wesley.
Great, thank you, Kerry.
The next question is, how will building proponents be inspired to shoot for net zero carbon emissions?
That is a very good question. So as part of the procurement model, we have something called the key result areas. And one of those key result areas is the whole life cycle and environmental sustainability. This process through the proponents actually encourages them to meet these targets and then stretch to exceed the targets. And there is money associated within the project for them to meet and exceed those targets. So we will be working with the proponents and encouraging them as they develop their designs further.
Is ground source or geo-exchange heating and cooling being contemplated? How will decisions be made in this respect?
So within the indicative design, and I'm going to preface it by saying it is indicative, the proponents will review it and look at it themselves, but within the indicative design, there was some consideration for geothermal and we elected to not pursue it for this particular project. I would ask maybe Kerry if you can add to that.
I can, and this is a really good question. One of the very unique things about hospitals is how much heat we generate just being a hospital. So one thing to remember is that in a hospital, we bring in air and we exchange air in a hospital at a very, very terrific rate. As an example, an OR changes its air every 20 times every hour. So the heat never gets to stick around for long. It gets in there and then it gets moved out. And we do that for infection control purposes. So our biggest source of low-level heat is actually the heat that's generated from the hospital. We have very significant air exchanges. We have very significant heat sources like MRI machines. So we're able to really harvest that heat through heat recovery and reuse it in many ways. And it's one of our most efficient models for operating a hospital because we have such a huge amount of naturally generated heat just operating the hospital. This is a really significant and deep question, Wesley. So I would really also like to look for the opportunity to even go in deeper technical details with the individual that posed the question. So I'd really be open to him or her reaching out to me and making connection, and we can do quite a deep dive on the technical aspects and how we are moving our hospital towards a very sustainable and energy efficient model.
Thank you, Kerry, and I see it's David. So David, if you'd like to reach out to Kerry through the new CDH email address, and we can set up a meeting to discuss your questions further if you would like. Next question, Deanna.
Next one is, will midwifery care be included in the maternity ward?
I think Janine, you're probably the perfect person to answer that for us.
Absolutely. So midwives have been a part of the planning process to date and are expected to continue to be a part of the model of care that we go forward with. They are currently a part of the CDH current practice and would be a part of the future.
Thank you, Janine.
Next question is to Greg. The main driver of the economy in the Cowichan Valley is small business. Will small businesses who are not unionized be able to participate in any aspects of the construction projects?
Oh, thanks. That's a great question. The short answer is yes, absolutely. I spent a lot of time talking to contractors, union and non-union, to let them know that projects that fall under the community benefits agreement are open to any contractor that's able to bid on them during the procurement process, but also whatever company wants to work on it, they're allowed to do so. Absolutely. The first priority of the community benefits agreement is to make sure that it's open to every contractor in the province. As far as the work site itself, the work site will be a unionized work site, and so workers there will become a member of one of the unions that we have partnered with for the community benefits agreement. And so for the time that they're on the project, yes, they will be unionized, but there's no requirement for the contractor themselves to have any sort of union affiliation either way.
All right, thank you, Greg. I hope that answered the question. Next question, Deanna, please.
What type of cooking and ovens will the kitchens be using?
I think that's yet to be determined, but I will lean on Kerry to provide us a little bit of guidance in design and construction.
Again, in our quest to reduce emissions, Wesley, we have elected for electrified ovens.
Thank you.
And I'm just looking at the clock. We may possibly have time for one more question. So this one is, will efforts be made to accommodate the needs of other cultures represented in our community, such as South Asian?
That's a great question. We are currently working through a process for our user group engagement going forward. Both the clinical directors and myself have had some discussions and ongoing discussions as to how we can engage with patient and families and other members of the community. So that is still in the process of being discussed internally from the project team, and we will hope to circle back to the community with the process that we've elected to proceed with come our update in September, October. So I see we're close to time. Do we have maybe one more question or?
Sure, yeah, one more question here. Again, it's for Greg. Any further news on the local supplier opportunities during or post-construction under Community Benefit Agreement Initiative?
Okay, another good question. What the first thing I'd probably say is that we're going to wait for the procurement to be completed before we go much further down that path. We're going to have a better idea of what opportunities there will be for local businesses and local suppliers once the once the constructor for the project has been selected. But in the meantime, we have been reaching out to some businesses on the island and in the Valley area. Specifically, we know that a hospital of this size is going to require a significant number of mechanical and electrical subtrades. So we have been reaching out to those groups to let them know and create some familiarity with the Community Benefits Agreement. We will, when we're at a point in procurement when we can do it, we will be holding information sessions for subcontractors and for businesses that are interested in learning more about how they can get to work on these projects. So watch those in the coming months as we're a little further down the road with the procurement process.
Great, thank you, Greg.
Panelists, actually, we just have one last question in the chat box, if that's okay, just one last from the audience. Do you anticipate a shortage of specific skills besides construction trades? Will there be an increased need for healthcare aides, for example? That's all.
Maybe I can ask Alice to provide a comment on that, if that's okay.
Certainly, and I think Janine will probably want to jump in as well. Currently, we are experiencing shortages in the health authority in the province, and we have a number of initiatives underway to look at enhanced recruitment and retention. So we're anticipating continuing to work through that as we advance towards the hospital, the new hospital. When we open the new doors, we will, given the new services and the increased beds, require additional staff on top of that. So we'll be doing some concrete and focused planning on that as we move forward. Thank you. Janine, if you want to jump in.
Sure. So, once we have a final design, we'll be able to look much more closely at what staffing models would support that design. We expect in all areas, including all of our support services, as well as our clinical disciplines, that we'll be needing to understand what that future demand is going to look like. So we are involved in looking at health human resource planning. We also need to look at that in the context of the community and the valley and the island. So we'll be doing that kind of exploration over the next year and a bit as we get closer to a final design. And then we'll begin also engaging with post-secondary schools that provide education for these folks, and talk about seats and possibilities to get the right people into those jobs. We also have a commitment also to look at our Indigenous youth and others to see if we can support and encourage them into some of the disciplines and jobs that we will have in that future and in the current space as well.
Great, thank you, Janine. So we really do not have time for additional questions, but I would like to thank everyone for their participation. I think we had about 42 members of the community and to participate, so we really appreciate that as a project team. And I would just ask that Joe Elliott, our Indigenous Special Projects Director, to provide a few words of closing.
Yeah, thank you, Wesley. I'd just like to echo some of the words and the importance of some of the Alcaminum words. Elder Ron talked about the importance of walking together, working together to help one another. Natsama, working together with a common goal. And you know, the collaborative effort for all the speakers here tonight, and bringing the voice to and share the information to our representatives and participants of this this information session. We cannot do it without you and without your questions, and some really great questions that came forward. So we thank you for your questions, and we thank you for your participating and knowing the importance of this new hospital. You know, a big hospital that's going to be a healing place for the Cowichan Valley residents and our communities working together. So we'd like to thank you for your collaboration and participating and asking those great questions, and we look forward for the continued working together. So hi, Chet, thank you.
Great, thank you, Joe, and thanks. I'd like to thank all the panelists for their participation, their expert guidance, and support for the project. I would like to thank the community as well for your engagement in this project, and we look forward to communicating with you for the next 4 or 5 years until we have the new hospital, and then you can celebrate with us as it opens. It would be a great milestone to reach. Thank you. Good night.